Do you struggle with fatigue? Do you struggle with anxiety? Somehow you're wondering if you have ADHD because you have a hard time concentrating and you didn't used to have a hard time concentrating. Maybe forget what I was saying. This is what my doctor asked me when I went to see him. At the Amen clinics, they ask 10 times in different ways if people have had any kind of brain trauma, like, have you fallen? Have you been in a car accident? Has something fallen on you? Did you bonk heads with someone? Or maybe you were in contact sports, football, or you hit the soccer ball with your head. It may be that you've had a concussion or multiple concussions and just not realized it because your brain was able to adapt and cover for it. So I actually fell 4.5 years ago. I fell on ice, which is the most common way to get a concussion, actually. Part of having head trauma is that then you have a hard time remembering it. And so what my brain scan actually revealed was that I had actually had 3 brain incidents in the past. By looking at my brain, they saw, of course, the low blood flow from the trauma that I was there for. What happens is, you have your first concussion and your brain is able to adapt and cover for it so that you compensate. And so you don't realize, you think you've recovered, but really your brain is just compensating. Then you have another one. And again, your brain compensates some more in addition to what it did before. But then there comes a time when your brain can't compensate anymore. You hit that tipping point and you all of a sudden just have massive symptoms from a seemingly small concussion, and your body just can't keep up anymore. But most people have this series of smaller concussions because of how many concussions happen a year. Your body adapts, and so they don't realize that they are not functioning on a full brain anymore. I talked to my dad after this doctor's appointment and how the doctor was most concerned about the brain, the trauma to the back of my head. And I told my dad, I've never hit the back of my head. And my dad said, well, actually, when you were probably 2 or 3 months old, I was making a bottle for you and you arched your back and kind of flung yourself out of my arms. You hit the wall and kind of slid down and landed face up behind the toy box. And so, that's something my dad had never thought to tell me. I mean, probably just never remembered it. Like, why would he? Until I shared that story. And so, so that was one brain incident that they found. Also, another one that they found was they noticed dimpling over my brain, and I had had carbon monoxide poisoning, that I had forgotten about. It looked like dimples of on my brain of places where there was low blood flow on the outside. And they said that's either a sign of carbon monoxide poisoning or someone who's done hardcore drugs, which I haven't had an issue with. Then as we're talking about all these things, then I remember other things. Oh yeah, there was that time when I was pregnant, and so you might be able to think back to things that have happened to you that affected your brain, that you thought, oh, it was an isolated incident, it's done, it's in the past, but really you could be accommodating in your brain and in your life for those incidents that you've had because of low blood flow in certain parts of your brain, and then your brain has to rewire to go around those parts that are not functioning, and that requires your brain to do extra work, kind of like someone with autism. It just has to go back and forth a lot more in the brain to find and do what it needs to do. A long way out from my injury, I can tell you there are certain days it really affects me. Sometimes there are certain weeks when I just have absolutely no motivation, almost don't even care about things that are important to me, like my health or my finances and things like that. And so if you're curious about this, you can start by seeing a functional neurologist. They can test your brain for some of these things. Also, getting a SPECT scan. The Amen Clinic was really helpful to me in that area. And then they assign you to a doctor who can look and see where the low blood flow is. And, they've been great about recommending supplements. You know, the one thing everybody recommended was vitamin D, also lots of magnesium to help calm the brain, and L-theanine's been amazing for helping with anxiety, but they will recommend things that are specific to you based on what your brain looks like. If they see that, oh, there's low blood flow here in the middle of your brain, well, that might be causing you to have problems with depression. Or if you're having low blood flow near the front of your brain, it might be that you're having problems with impulse control all of a sudden and you're just wanting to eat like crazy. And so what was crazy for me was the doctor looked, before we even talked about my symptoms, he looked at the image of my brain and he started saying, oh, you have low blood flow here, so people who have low blood flow here usually struggle with, just started telling me all my symptoms, like without even like looking at my symptoms. He could tell by looking at my brain. And so he was able to recommend certain, between the functional neurologist, they were so there were 3 things that the doctor helps with: how to rest your brain, so that strategies for resting your brain so it can recover, and also how to rehab your brain so that it can get better and rewire so it can function better without so much work, and then your brain doesn't have this fallout where you have all your symptoms coming up. And then also they help with showing you how to regulate and your nervous system, because all of that runs your life. So if you're curious about more, I have other videos that talk about my experience and also things that you can do. I have a video all about supplements doctors have recommended for me, and also just other therapies that I've tried to in my journey. So check them out, and I hope this has been helpful to you, and maybe to a friend too. Pass it on if you think it would be helpful to someone else in your life. Do you find that you get really tired after being around people for a while? And maybe you just feel like, oh, I used to like being in big crowds, but now it just wears me out. I just don't have an interest in that. Feels like these little things, like maybe calling to fix an error on a bill, you find yourself avoiding it, or maybe having a conversation and something relatively small that didn't used to bother you, like telling someone that you need them to put the dishes away. It suddenly is something that you're avoiding when you wouldn't have necessarily done that in the past. So all of these might just feel like, oh, life is busy, or maybe my personality's changed a little bit over time as I've gotten older,